I never watch medical dramas because they're so annoying. We know perfectly well that we're watching an amazing illusion. A flat two-dimensional screen becomes a window on another world, where we can watch unseen the interaction between characters. Yet we know they're actors following a written script. Behind the camera there's a whole paraphernalia of equipment and often a large crew. The complex interplay between the crew, the equipment and the actors is often a drama in itself. We become absorbed into the story of the brave doctor battling to save the patient. And then they do something incredibly stupid that even a first-year medical student wouldn't do, and the illusion is destroyed. The most common error is the back-to-front stethoscope. These are very handy gadgets that enable us to listen to blood vessels and lungs and hearts, and also to take a blood pressure. Now, what is it with actors? They almost always get it wrong. The correct method of putting it on is like so, where the earpieces point backwards to align with the ear canal, or the external auditory meatus in medical parlance. This is completely wrong. This tends to occur when there isn't a proper medical consultant on set. The advisors for the film Raintown were having no nonsense, and even the doctor's brother wasn't allowed to mess it up. Back-to-front stethoscopes and upside-down x-rays are quite mild by comparison to some of the other horrors in films. Cardiopulmonary resuscitation, or CPR, is usually done incorrectly. It is usually too feeble with the wrong rate of compression. The procedure is rather violent and should only be done if you're certain that the heart has stopped. This is, of course, highly dangerous on a film set and would probably kill the actor. The advice has varied considerably over the years, but the current procedure is 2 breaths and 30 compressions to the beat of Staying Alive by the Bee Gees. Or, if you prefer, the Imperial March from Star Wars, or any tune with 100 to 120 beats per minute. Sadly, the average survival rate for CPR intervention in cardiac arrest is only 36%. This isn't because bystanders are doing it wrong, although that is undoubtedly a factor. It's because CPR is a rubbish procedure, but it's all we have. The rate is much higher for CPR in hospitals, but the overall survival rate depends on a multitude of factors and is still fairly low. However, films and TV shows would have us believe that CPR works almost every time and the patient can be perfectly normal and walk around after a few seconds. Similarly, characters who are hit on the head and pass out recover miraculously when they wake up. In reality, however, this almost never happens. If the blow has occurred with sufficient force to cause unconsciousness, then the risk of brain injury is quite likely. Traumatic brain injury is a very serious problem which can lead to all manner of quite dangerous outcomes. Patients who are unconscious need to be sent to hospital for monitoring, since the effects of hemorrhage or neurological damage may take hours to become apparent. Gunshot wounds, according to Hollywood, are either instantly fatal or afford a complete recovery within a few hours. Neither of these outcomes are particularly realistic. Much depends on the velocity of the bullet and a whole series of random factors such as where the bullet enters the body and what it bounces off while it's passing through. In general terms, high-energy rounds from a rifle will do more damage than a handgun. The kinetic energy of the round is dumped into tissues and creates a widespread cone of destruction along the path of the bullet. The small size of the entry and exit wounds hides the amount of internal damage. In films, much effort is spent on removing the bullet, more often than not performed with forceps close to the entry wound. After this, the patient makes an astounding recovery. In reality, however, bullet removal tends to complicate surgery. It's often difficult to find as a result of the complex path through the body. Perhaps Hollywood's obsession with bullet removal might date from low-energy musket fire, where the ball would pull in a fair amount of clothing and cause widespread infection. Removing this material in an age of no antibiotics would make a lot of sense. However, home surgery as depicted in films and TV shows would probably result in septicemia and death. Surprisingly, outcomes for gunshot wounds treated in hospital, providing the patient actually gets there, are fairly reasonable, with a good chance of surviving with minimal physical injuries. The worst culprit for the misuse of medical equipment in films and television is the defibrillator. The heart is built of cardiac muscle. These are specialist cells that have their own internal rhythm and contract all by themselves. In order for the cells to contract all at the same time, there is a complex system of neurological control. This generates a precise sequence of electrical events in the heart to enable it to contract and expand. Not unsurprisingly, things can go wrong with this process. If the cells fail to synchronize properly, then the heart stops pumping and cardiac arrest results. Failure of the contractile synchronization is termed fibrillation and can have multiple causes. Nerve and muscle cells don't use electricity as such, but use a similar trick using ionized atoms to flow quickly across a membrane, which mimics an electrical current. The defibrillator uses a physiological effect caused by the delay in pumping the ions back across the membrane. A reasonably large direct current charge resets all the cardiac cells simultaneously, and they are therefore receptive to the heart's internal conduction system again. Recent advances have been made with the use of automated external defibrillators, or AEDs. These devices handily tell bystanders what to do and detect whether fibrillation is present or not. The research would suggest that these devices can nearly double survival rates, although the overall rate is still less than 50%. What a defibrillator can't do is restart a heart with no electrical activity. It does exactly what it says on the box. It defibrillates, if you're lucky. There are circumstances where a flatlined heart can be restarted using a defibrillator. For example, restoring sinus rhythm to a heart undergoing surgery with a heart-lung machine. However, the process is complex and requires careful supervision in surgery. Therefore, pretty much every film and show you've seen with a flatline electrocardiogram trace miraculously transformed to sinus rhythm is abject nonsense. And with CPR, the patient is apparently able to get up and walk around after a few minutes. This is singularly ridiculous due to the same issues of brain anoxia. How can we improve on this increasing saga of nonsense? Sadly, there's no equivalent to the old Hollywood code applied for science, technology and medicine. It's merely a matter for the conscience of individual writers and directors. Thanks for watching, and remember, unlike actors, doctors actually know what they're doing. Mostly.